Most people have between 10 and 40 moles scattered across their bodies. These small, usually brown spots are incredibly common and typically harmless. They're just clusters of pigment-producing cells called melanocytes that have grouped together. But here's the critical truth that everyone needs to understand. Not all moles are benign. Some moles can be warning signs of melanoma, the deadliest form of skin cancer. The good news is that when melanoma is caught early, the 5-year survival rate exceeds 98%. But that survival rate drops dramatically to just 35% if the cancer spreads to distant organs. This stark difference makes early detection absolutely crucial. The challenge is knowing which moles deserve attention and which ones are perfectly normal. So let's talk about 7 types of moles that should never be ignored. This information is presented in a clear, educational way, focusing on what people need to know to recognize these warning signs and seek prompt medical evaluation. Understanding these distinctions could literally save someone's life. Before diving into the 7 types of moles that warrant concern, it's important to understand what a normal, harmless mole looks like. A typical benign mole is evenly colored, usually a single shade of brown, tan, or black. It has smooth, well-defined borders. The edges are clear and regular, not jagged or blurred. Normal moles are symmetrical, meaning if someone draws an imaginary line through the middle, both halves match. They're typically smaller than 6 millimeters in diameter, about the size of a pencil eraser. Most moles develop during childhood or young adulthood, and once they appear, they generally remain stable in size, shape, and color throughout a person's life. With that baseline understanding established, let's explore the 7 types of moles that require medical attention. Mole type number 1, the asymmetrical mole. The first type of mole that should never be ignored is one where the two halves don't match, an asymmetrical mole. If someone draws an imaginary line through the center of a concerning mole, one half looks distinctly different from the other half. The shape might be irregular on one side, or one portion might be raised while the other is flat. The coloring might be darker on one side than the other. This asymmetry is one of the hallmark features of melanoma. Normal benign moles are round or oval and symmetrical. Both halves are mirror images of each other. Melanomas, in contrast, grow in an irregular, uncontrolled pattern that creates this characteristic asymmetry. The cancer cells don't respect normal growth boundaries, so the melanoma expands unevenly. Research has consistently identified asymmetry as one of the most reliable early indicators of melanoma. It's the A in the widely used ABCDE rule that dermatologists teach patients for melanoma detection. When someone notices a mole where the two halves don't match, that's an immediate signal to schedule a dermatology appointment. It's important to note that not every slightly asymmetrical mole is cancerous. Some benign moles have minor irregularities, but pronounced asymmetry, where the two halves look distinctly different, is concerning enough to warrant professional evaluation. A dermatologist can examine the mole more closely and determine whether a biopsy is needed. Mole type number 2, the mole with irregular borders. The second type of mole that requires attention is one with borders that are irregular, ragged, notched, or blurred, rather than smooth and well-defined. Normal moles have clear boundaries. There's a distinct edge where the mole ends and normal skin begins. The border is smooth and even, creating a clean outline. Melanomas, however, tend to have messy borders. The edges might be jagged with irregular notches. The border might appear fuzzy or blurred, with the pigment seeming to fade into the surrounding skin. Some melanomas have scalloped edges that look like the outline of a coastline on a map. These irregular borders occur because melanoma cells invade surrounding tissue in an uncontrolled manner. Unlike normal melanocytes that stay neatly contained, cancer cells spread outward irregularly, creating those characteristic ragged edges. The irregular border is the B in the ABCDE rule. When examining moles, people should look at the outline carefully. If the border isn't smooth and circular or oval, if there are notches or irregularities, or if the edge looks blurred rather than distinct, that mole needs professional evaluation. Sometimes the pigment from a concerning mole will appear to bleed or spread into the surrounding normal skin, creating a halo effect around the mole. The spreading of pigment beyond the mole's border is particularly worrisome and should prompt immediate medical attention. Mole type number 3, the multicolored mole. The third type of mole that should never be ignored is one that contains multiple colors or has uneven coloring rather than being uniformly brown. Benign moles are typically one consistent color throughout. Whether that's light brown, dark brown, tan, or black, the color is uniform across the entire mole. Melanomas, in contrast, often display a variety of colors. Someone might see different shades of brown, tan, or black all within the same spot. As melanoma progresses, other colors can appear: red from inflammation, white from areas where pigment has been lost, or even blue, purple, or pink tones. This color variation happens because melanoma contains cells at different stages of development and with different levels of pigment production. Some areas of the tumor might be producing large amounts of melanin, while other areas produce little or none. Areas of inflammation, bleeding, or tissue death within the tumor create additional color variations. The color variation is the C in the ABCDE rule. When examining a mole, people should look for any variation in color within the mole itself. Multiple colors within one spot, particularly if those colors include red, white, or blue in addition to various shades of brown and black, are concerning features that require dermatology evaluation. It's worth noting that some people have moles that are consistently a lighter brown or tan color, and that's completely normal. The concern is when multiple different colors appear within a single mole, or when a previously uniform mole develops color variations. Mole type number 4, the large diameter mole. The fourth type of mole requiring attention is one that's larger than 6 millimeters in diameter, about the size of a pencil eraser. While melanomas can certainly be smaller than this threshold, and not every mole larger than 6 millimeters is cancerous, size does matter when assessing moles. Research indicates that most melanomas are larger than 6 millimeters when detected. Large moles have had more opportunity to accumulate the genetic changes that can lead to cancer. The diameter criterion is the D in the ABCDE rule. People should pay particular attention to any mole that exceeds pencil eraser size, especially if it's growing. A mole that has always been large and stable is less concerning than one that's progressively increasing in size. However, dermatologists caution that people shouldn't dismiss smaller spots. Some melanomas are detected when they're quite small, even just a couple of millimeters in diameter. The key is watching for change. A small spot that's growing should be evaluated even if it hasn't yet reached 6 millimeters. Additionally, if someone has a large mole that's been stable for years but suddenly starts changing in any way, developing irregular borders, color variations, or other concerning features, the size combined with the change makes it particularly worrisome. Mole type number 5, the evolving or changing mole. The fifth and perhaps most important type of mole that should never be ignored is one that's evolving or changing over time. This is the E in the ABCDE rule, and many dermatologists consider it the single most important warning sign. Generally speaking, adults shouldn't be getting new moles, and existing moles shouldn't be growing or changing significantly, particularly after age 40. Most moles develop during childhood and adolescence, then remain stable throughout adulthood. Any mole that's changing in size, shape, or color deserves immediate attention. A mole that's growing larger, even if it remains symmetrical and evenly colored, is evolving and needs evaluation. A mole that's changing shape, perhaps becoming more irregular or asymmetrical, is concerning. A mole that's developing new colors or whose existing color is intensifying or fading is evolving. Changes in texture are also significant. A mole that was previously flat but is now becoming raised, or one that's developing a rough, scaly surface, should be checked. A mole that starts itching, becomes tender or painful, or begins bleeding without being injured is demonstrating concerning evolution. Research shows that approximately 70 to 80% of melanomas develop as new spots on previously normal skin, rather than from existing moles. This makes any new spot appearing on the skin, particularly in adults over 35, worthy of attention. New spots that appear and show any of the other ABCDE characteristics: asymmetry, irregular borders, multiple colors, or large size are especially concerning. The key principle with evolution is this: change is not normal for moles. Moles should be stable. Any change over weeks or months, whether in size, shape, color, texture, or symptoms, requires medical evaluation. Mole type number 6, the ugly duckling. Mole. The sixth type of mole requiring attention is what dermatologists call the ugly duckling, a mole that looks noticeably different from all the other moles on someone's body. This recognition strategy is based on an important observation. Most people's moles tend to resemble each other. Someone might have many small, round, light brown moles scattered across their body, and they all look similar. Or they might have several slightly larger, darker moles that all share similar characteristics. These patterns are normal, but when one mole stands out as distinctly different from the rest, when it's the ugly duckling in a group of similar-looking moles, that's a red flag. The ugly duckling might be larger than all the others, or much darker, or a completely different shape. It might be the only mole with irregular borders when all the others have smooth edges. Or it might be the only one with multiple colors while the rest are uniformly brown. Medical research has validated the ugly duckling sign as a useful tool for identifying melanoma. Studies show that melanomas often look different from a person's other moles precisely because they're growing abnormally. The cancerous growth pattern creates features that stand out from benign moles. This concept also applies to isolated moles, spots that appear alone without other moles nearby for comparison. These isolated lesions, particularly if they develop suddenly in adulthood, should be viewed with suspicion and evaluated by a dermatologist. Mole type number 7, the symptomatic mole. The seventh type of mole that should never be ignored is one that's causing symptoms, particularly itching, tenderness, or bleeding. Normal benign moles typically don't cause any sensations. They're just there, neither itchy nor painful. When a mole starts itching persistently, that's unusual and potentially concerning. Research indicates that approximately 22% of melanoma lesions involve itching as a symptom. While itching can certainly have innocent explanations, dry skin, irritation from clothing, or allergic reactions, when a specific mole becomes persistently itchy, that deserves medical attention. Tenderness or pain in a mole is equally concerning. Moles shouldn't hurt. If a mole becomes sensitive to touch or develops pain without obvious trauma, that's a warning sign that something abnormal is happening. Bleeding is particularly worrisome. A mole that bleeds spontaneously without being injured, or that bleeds from minimal contact like light rubbing or washing, needs immediate evaluation. Some melanomas become fragile and bleed easily as they grow. A mole that bleeds, forms a crust or scab, seems to heal, then bleeds again in a repeating cycle is especially concerning. Some people also notice oozing or weeping from a concerning mole. This discharge, along with crusting, suggests that the mole's surface is breaking down, a sign of possible malignancy. Certain people face higher melanoma risk and should be especially vigilant about monitoring their moles. Those with fair skin, light-colored eyes, and a tendency to freckle or burn easily are at elevated risk. People with more than 50 common moles on their body have increased risk, as do those with dysplastic nevi. Unusual-looking moles that are larger and more irregular than typical moles. Anyone with a personal history of melanoma faces significantly increased risk of developing another melanoma and should have regular professional skin examinations. Family history matters too. Having close relatives with melanoma increases risk. People who've had severe sunburns, especially in childhood, or who've used tanning beds are at higher risk. For these high-risk individuals, any of the 7 types of moles discussed here should prompt immediate dermatology consultation rather than a wait-and-see approach.